And I hand it over to our chair and EMC, Dr. Andrew Plump of Takeda, who has really worked very hard, harder than me, to put this together. Over to you, Andy.
Well, thank you very much, Karun. I don't know that I'd say that I worked very harder than you, but I certainly did work hard, and I'm really glad to be here. And I apologize for my chin Band-Aid, which is I took a punch on the chin this morning from my razor. The razor knocked me out. It's such a pleasure to be here with you for this 16th annual USA India Chamber of Commerce Bio Summit. I've been involved with this organization. It's a wondrous organization for the last 12 plus years. And I've had the great privilege of being the master of ceremonies for this terrific event for the last 7 years, including now the third year running, doing this in a virtual format, which now gives us a chance to engage so many more people. And we have thousands, literally thousands of individuals, scientists and participants locally and from across the world who are participating. So we hope that you have a really terrific time. And I'd like to make a few introductory comments. And if I could please pull up my slide deck, if that would be okay. The first slide is actually the same slide that I showed as my last slide last year. And it was a slide that left us with some degree of optimism as we saw a pandemic that we thought was starting to power down. You know, short of the slides, last year at the very end of my talk, I suggested that we were in the throes of optimism, that we had taken great learnings from this COVID pandemic, and we had an opportunity to apply these learnings not just to what we do during a pandemic, but to everything that we do in our business. And of course, I left with optimism. And now, as we pause a year later and we look back a year, what happened? Well, I would say that some good has happened and some not so good has happened. We're in a very difficult state. There's a raging war that threatens world order and democracy in Eastern Europe. We're battling the highest in the United States, the highest inflationary measures that we've seen in literally decades. We still have a pandemic that simmers, just coming out of a major lockdown in China. We've had a lot of hardship, and there's been a lot to worry about. I think a lot of us question where we sit right now and what comes with our future. But we, in our industry, we are used to headwinds, we're used to challenges, and we know how to step up and be resilient. And that's exactly what we need to do. And we have great means for optimism. Say, please go to the next slide, because what I would have liked to have talked about is India. I'd like to talk about India. One of the great parts about this summit is that we actually bring together two worlds: the world of incredible innovation and the world of access. And we bring together scientists who have such a passion and such a curiosity for science and for learning, for innovating, and for doing the right thing. I think as scientists, though, in industry, we also have a great interest in driving access to our medicines. And there's no country that is representative of the challenges that we face as much as India. It's the second largest country in the world. Despite the fact that it's the second largest population with well over 1 billion people and so many patients, it's a population where only 1.2% of global trials enroll patients. Only 1.2% of trials that are run in India in the world enroll patients in India. This is actually horrendous. Now, by perspective, almost 40% of trials run in the world enroll in the United States, close to 30% in Europe. Interestingly, China, which is on the upswing, only has 6 or 7%, but there are great trends in China. We don't see those trends in India. Another fact that's quite interesting about India is that 65% of the population is rural based. Why is this important? Because the vast majority of clinical trials are run in major cities. If you look at the United States, under 20% of the United States is rural based. Even if you look at China, which is approximating India, only about 30 to 35% of the population is rural based. So this rural based population means that not only are we having trouble getting into India, but once we do, when we get to the cities, which is likely, we're going to have huge troubles in actually getting to the vast majority of patients. And I'll come back as I talk about things that we can do around digital and data that could be helpful. The next topic that I, again, would have liked to have shown you would have been data around diversity, equity, and inclusion, because what we see in India in terms of the limitations of access and to some extent the oppression to underrepresented individuals, oppression, by not giving them access to these innovative medicines, it's the same thing that we see here in the United States. We have a huge issue in the United States with respect to access to our innovative medicines to the underrepresented minority populations. In fact, 60% of the 60% of the population in the US is white, 40% is non-white, yet only 25% of that non-white contingent of individuals is enrolled in our clinical trials. And if you actually take out the Asian population, which is overrepresented in clinical trials in the United States relative to their demographic, you think about Hispanics and Latinos, it's only about 50% less of the population that's represented in clinical trials. It's really a major challenge, but we have solutions. Actually, one of the solutions rests in digital and data. We've made huge headway over the pandemic in particular in leveraging technologies that allow us to run trials in different ways, allow us to run trials remotely, allow us to run trials using decentralized structures like decentralized IRB, and even allow us to run trials in some places even virtually. Now, why is this important? It's important because it's going to increase our efficiency in running trials. It's also important because it's going to increase our access to these underrepresented patients. And eventually, when we make it to India, it's going to give us and help to give us access to these individuals in rural settings. I'm very hopeful. We at Takeda are making huge strides in this regard. In fact, we expect over the next 2 years that we'll go from about 35% of our trials today that are leveraging hybrid, virtual, and decentralized capabilities to 100% of our trials. And I think that that's true for most of us across the industry. There's huge hope. There's huge hope. I'd like to end actually on hope and just highlight the incredible work that we'll hear about today and that this industry is doing together with many of our partners across the sectors, including academia. We are in an entirely exciting era for healthcare. In fact, if we look back, for those of us that are able to make it into the 22nd century, which probably aren't very many of us, if we look back at what defines the 21st century, I'm convinced it will be healthcare and life sciences. We are in a golden era, and there is just so much that we can do when we step up and band together. We have a great day ahead. It's a continuous day. There are no breaks, but it's virtual, so you can come in and out as you like. For those of us that have to be here, we're going to be hungry and thirsty, but that's okay. Don't worry about us. We'll deal with it. So let's step into the day and let's not, I hope you enjoyed the slides, by the way.